Well, Dr. Paul Spiegel is the director of the Johns Hopkins Center for Humanitarian Health. He joins us now live from Cairo. Welcome, Doctor, to the program. Now, you are a war zone doctor. You're a well-known and respected humanitarian emergency responder. You've seen emergencies all around the world. And we've just heard the UN, they're calling the situation in Gaza textbook formula for epidemics. You're in Egypt right now, I believe, to understand the latest on Gaza. What are they telling you there? What action plan is this? And how does this compare to anything you have seen before? And just another question, I'm giving you 3 questions in one. How are we at this stage after 60 days, nearly 70 days?
Yeah, thank you. Thank you for the questions. This is an unprecedented situation, I must say. I've responded to many disasters, and I've been here now for 3 weeks. And what we're seeing here is unique for a variety of reasons. Number one is that in many situations, people are able to go to a safe haven. So they whether they stay in their country or they leave a country, they're able to find safety and security. In this situation, there is no safe place for the people to go. And on top of that, there is no what we call humanitarian space, meaning that humanitarians aren't able to surge in and to be able to support the health systems in Gaza. And so what we're seeing is people crammed into shelters. I have been looking at some of the data from UNRWA, the UN Works and Relief Agency. People in Rafah, on average, in these schools, which are acting as shelters, averages about 11,000 people in the shelters, some as large as even over 30,000. The water and sanitation is horrific, and therefore we're not surprisingly seeing increases of numerous diseases, including diseases of epidemic potential.
Okay, so what is everyone going to do about this? Because we've been hearing these statistics, epidemic. We've been hearing a graveyard for children. We've been hearing all these words now for nearly 70 days.
Yeah.
Why can't they just go in? Why can't Egypt just open that gate? Really, it just feels like it's just words on every single level. And yet these images that we see, I mean, you know better than I, people are having operations without anesthesia, no food, no clean water. You must be tired yourself, doctor, of hearing just words. I mean, why is there no action? And it's cold, it's raining. Yesterday there were images going around of a teenager carrying a child in the rain. Why is there such little action?
Yeah. We deal with the humanitarian and the public health issues. And in terms of action, this is all about political aspects. So it's Israel, it's Egypt, and then other countries that are working with them to put pressure on to be able to, I guess the best case scenario by far would be a ceasefire where then the humanitarians are able to go in and support, and then we're able to provide healthcare, shelter, and clean water. Everyone, the UN and the international NGOs, are already prepared to do that. But it is beyond, sadly, despite even the Secretary General requesting and talking about how horrific the situation is. These are the political powers that are dealing with the situation that must allow that to happen. And until that happens, we're doing our best. A limited amount of goods are getting in. It's not nearly enough. We're planning already in terms of responding to epidemics. But if we don't have access, we're very concerned because most of the epidemics that we will see will be water and sanitation borne. And there's going to be a limited response that both those in Gaza who are doing all the care and the humanitarians outside of Gaza that are waiting to get in. So we're very afraid that even though we are following and we're aware of what is happening on the ground, without safe zones and or a ceasefire, the epidemics are going to be extremely difficult to be able to respond to.
Now, the word famine was used by the UN this week as well. How close is Gaza to famine?
Yeah, there's a group looking at this, an IPC, and they're gathering the data. Famine is a very technical, and it's a very clear objective ways of measuring it. So from what I'm gathering at this point, there is extreme food insecurity, but the declaration of a famine is not yet there. However, again, I can just say that without ensuring that food is coming in, and I'm working with people from Gaza, and I'm speaking every day to healthcare workers in Gaza. And what often isn't discussed actually is that it's these people who are providing healthcare are equally displaced. Many don't have shelters and are suffering the same as as all other people. And so we learn even from them that they're eating one meal a day, and they're not able to. The markets are not full, and even if they have money, the prices are so high that they can't get food or buy food. So, in some ways, it's very important if and when a famine is declared. But at this point, that's not the case. But regardless, we don't want to wait for that to happen. And the same as with other aspects, we need to be able to have food and water, most importantly, food, water, shelters. We need to be able to have the space to be able to respond.
Dr. Spiegel, fantastic to have you on the program. That was Dr. Paul Spiegel, Director of the Johns Hopkins Center for Humanitarian Health. We wish you the best of luck with your talks there in Cairo. Thank you.